So, good day. This is Dr. Ed Zimmerman. I am your host for the next few minutes, and I'm joined with Dr. Gail Humble, the inventor and genius behind Klotho Skin. And we're going to present a PowerPoint that was originally presented at the American Academy of Cosmetic Surgery in the February of 2024 on Klotho-containing serum inducing a robust protective response against UV radiation in human skin cells. So this is a very, very, very neat technology that we've adopted in our office and want to share with everyone else. And disclosures, I am proud to be on the board of Klotho Skin. Dr. Humble was kind enough to include me because I went, this is a really cool technology. We need to use it and get it out there. Dr. Humble, of course, is CEO and Chief Science Officer of Klotho Skin. And to brag on her just a little bit, she graduated with a Bachelor of Science in Genetics, and then went to medical school in Texas. She has extensive experience in the regenerative and aesthetic fields. She has practices in San Francisco and Los Angeles. She's a member of a number of important regenerative societies like the International Society of Stem Cell Research, the American Cosmetic Cellular Medicine Association, and the International Cellular Society. She's been working with this Klotho gene and perfecting this technology for nearly 2 decades. So we're very proud and humbled to be with Dr. Humble. She's going to let me do some of the initial talking, and then she will dive into the science and some of the research that has been done on this. So that's what it's all about. And whenever I do a PowerPoint, I always put up some learning objectives that I'd like the audience to be able to appreciate. And so when we presented this in front of physicians, we asked them to be able to describe the impact of UV radiation on human skin, to appreciate the improvement in wrinkles, texture, and UV-induced pigment changes that were demonstrated in clinical trials with the Klotho Skin serum, and that people should understand how the Klotho gene or Klotho protein protects against UV-induced DNA damage and photoaging at a cellular level. So some fun facts. Skin is the largest organ of the body. 100% of the patients who walk through my door have it, and it is a harbinger to many of the systemic issues that occur in the human body if we just pay attention to that big neon sign that's flashing before us on the skin. UV exposure causes DNA damage, we know that, and it accelerates photo damage and skin cancers. UVA is 300 to 400 nanometers in terms of the spectrum of radiation, and it makes up about 95% of the solar radiation that reaches the surface of the Earth. We do have physical SPFs that are more efficient at blocking UVA and UVB, so things that have micronized titanium and zinc are more efficient and better sunblocks, and there are about a dozen chemical blocks in the US, but only avobenzone is the only one that's active in the UVA wavelengths of 320 to 400 nanometers. So we're limited there. So stick with your physical blocks, but we need other solutions for protecting human skin. And one of those is the Klotho gene. It's named after the Greek goddess of fate and destiny of mortal life. It was first documented as an age-suppressing gene in mammals, and it delays aging when it's overexpressed or upregulated. It accelerates aging when the gene is disrupted or underregulated or underexpressed. It protects against oxidative stress on a cellular level, and that's kind of the key that makes this an entirely new technology. This is not just your grandma's night cream. This is something entirely different and really can help our patients a lot. So the Klotho gene was originally identified as a mutated gene in a particular mouse strain that showed a syndrome resembling human aging. And so you had mice with shortened lifespan, skin atrophy, muscle atrophy, nerve degeneration, arteriosclerosis, osteoporosis, and pulmonary emphysema. So these were not happy mice. So you can see if you're watching this on YouTube, the bottom corner is the downregulated Klotho gene, and the happy perky mouse up above it is the happy mouse that all of us want to be. So overexpression of the Klotho gene extends lifespan and everything it has to do with it, and there's a reference there for you. And then this is next slide is a picture of Klotho's deficiency and overexpression compared to a normal mouse. So if we look at the mouse on the left, from my point of view, that's a normal mouse. And the scrawny one in between, that's a Klotho deficient mouse. And this big, happy, healthy, furry, pink-eared critter, who's much bigger than his brothers or sisters, is a Klotho overexpressed gene mouse. And that's what we all want to be. We all want to be the younger, bigger brother. So we know we need technologies and compounds that work better than our chemical SPFs that we have available. And Klotho is just that. So we know that we're able to reduce age-related DNA damage and DNA damage to acute exposure of UVA1, which is about 365 nanometers. And what happens at a cellular level is Klotho induces production of superoxide dismutase and catalase. So those help preserve the cell at a telomere level. We know that mice that have an overexpression of the Klotho gene live 31% longer and they look younger. So wouldn't you like to put that in your cereal bowl every morning? I've been using it on my face, but I may have to start eating it, Dr. Humble? So anyway, one of the neat things is that, in the mammalian model of the mouse, humans share this age-suppressing gene. And, when we know that when we, as humans, have low Klotho levels and we get older, it's an independent predictor of mortality. So people with higher Klotho levels at age have a decreased overall risk of death from all causes. So I want to be the higher endowed Klotho mouse. Lower levels of Klotho in humans are associated with generalized aging, renal issues, cardiovascular issues, pulmonary issues, metabolic issues, cancers, neurologic issues, psychiatric disorders, and autoimmune disease. But hey, welcome to the world. None of us want those things. And if we can at least save our skin, the largest organ of the body, well, that would be a noble thing to do. So at this point, I'm going to ask if Dr. Humble will start to elucidate us about some of the research and things going on with Klotho and the Klotho gene.
Absolutely, Ed. Thank you, first of all, for having me. And I just want to say, we never have done any animal testing. Those mice actually happened on their own. It was a natural upregulation, which was fascinating. So just wanted to make that clear for all of us animal lovers. All right, let's talk a bit about what the Klotho gene and protein do on a cellular level. And yes, it is a gene, part of your DNA, and it's a protein that we'll discuss later on. So keep those two separate. It can get a little confusing. In every cell that we have, there's a system. When we increase the Klotho gene and get the Klotho protein on a cellular level, it increases something called FOXO1. When FOXO1 is increased, this increases superoxide dismutase and catalase. Dr. Zimmerman already mentioned them, but what they do is they keep any oxygen from being a free radical or causing tissue damage. In other words, as a result of the Klotho protein, we have an increased resistance to oxidative stress. This leads to cellular longevity. And with cellular longevity, we have an anti-aging effect.
Next slide. Just let me know what.
Next slide. Yeah. Sorry about that.
We're sharing this screen. I just need to learn to share better.
I think you're doing great. Okay, so this is the little diagram of what's happening on the insulin pathway. Basically, the Klotho protein is blocking the autophosphorylation and increasing FOXO1, which once again, now that you're all experts in biology, increase superoxide dismutase, known as SOD, and catalase. I want to spend 2 seconds on this slide. Perhaps you've all heard about the study that was done eons ago. They had people that were starved, but got their basic nutrition, and people that could eat whatever they want to, or animals in this case, excuse me. And the ones that lived longer were the ones who actually were semi-starved but got their nutrition. That was actually replicating exactly what's happening with this pathway, the insulin pathway. So we're kind of changing all that and directly influencing it. Next slide. Okay, so this is a very complicated slide, but first I want you all to visualize along with me. Remember in high school when you had a petri dish and you had cells in there? Well, you have to feed the cells, and we feed them agar, kind of like a bone broth, and then they excrete. If you want to say they pee, that also is accurate. That excretion is actually filled with really good things because they're stem cells such as growth factors, and in our case, the Klotho protein. So when you hear me talk about the cell-conditioned medium, I'm actually talking about the excretion that come directly from the stem cells. All right, going forward, we knew we had to take adult mesenchymal stem cells, which mean they come from fat, and we needed to upregulate or overproduce the Klotho protein. So what we did was we worked with a vector, which is like an arrow, and a construct, which is like an on switch. We then did transfection, which means we shot the arrow into the DNA of the stem cell, turned on the Klotho gene, and as a result, got the Klotho protein and second-generation growth factors in the cell-conditioned medium. Once we got one cell, we needed to multiply them multiple times. Then we got a larger amount of cell-conditioned medium, and the last little picture you're seeing is showing an ELISA assay, which is an advanced test to check that we did have, in fact, the second-generation growth factors and the Klotho protein in the cell-conditioned medium. Next slide.
So in this slide, just for clarification for people who are listening to this on podcast, you're starting with the picture in our upper left and moving to the lower right in the scheme of things? Okay. All right. Next slide it is.
All right. So let's talk about what happened with our first cellular study. We took human dermal fibroblasts or skin cells, and we separated them into two groups, a control and a group that was pretreated with this Klotho cell-conditioned serum. We then took UVA irradiation, and we took two different concentrations of the Klotho serum, 0.5% and 1%. We UVA irradiated these cells to initiate damage and compared the two of them to see how the control performed in DNA damage compared to the Klotho bathed cells. Now, the way we did this was with a NIH-backed, completely novel way of monitoring DNA damage, and we're actually measuring the DNA strand damage. Keep in mind, UVA irradiation is usually responsible for a lot of our skin cancers and things such as that, whereas the UVB is what affects your collagen and your elastin more. So UVA is really, really important. Okay, next slide. So this shows the graph and the result of the study. Each one of those little points represents 250 to 40 cells. In all, we did 50,000 cells. We did 15 replications of the study. And in each case, we found out the cells that were bathed in this Klotho cell-conditioned medium, the DNA damage was reduced by 40%. Next slide.
Pretty impressive.
It is. So again, I mean, this is hugely statistically significant. Beyond that, this is a 40% reduction in DNA damage. And keep in mind, depending on where your age is when you're listening to this podcast, your DNA damage starts really young in your life. So you don't have to wait till you have photo damage or wrinkles or dyschromia, pigment changes to start getting treated. The sooner you start with this, the sooner you reduce the DNA damage. So overall, our cellular results suggest the Klotho protein is protective on a cellular level, as you are already experts on. Now, we found something else here as well. The telomere, I think maybe most of you have heard about it, is like the holy grail of a cell. It looks like this. And a telomere can only be so long. Once the caps or the tips hit the end of the cell, it shortens and shortens, and eventually there's cellular death. What we found out was when the Klotho serum was also in the cells, two other genes were actually upregulated, whose job is to protect the end of the telomeres. So the cells were actually living longer from that as well.
Very
Next
cool.
slide.
I learn something every time I talk to you.
Just don't fall asleep. Okay, so then the studies from the first study was remarkable, but we decided maybe we overdid it. So then we reduced the UVA damage down to just 8 hours level of sun exposure. This is something we all get, maybe not in Alaska. I don't know. Anyway, we ended up seeing the exact same results. We didn't see the UVA cell-related death in the control. So at a lower level, the cells weren't dying as much as they were in the previous study in the control. But there was still a 40% reduction in DNA damage. Next slide. So the reduction was not simply attributed to lower levels of DNA when they started. We knew this. It was actually really attributed to the protective level that the Klotho protein does on a cellular level. Next slide. Okay, so what we did, now that you all have your great visual with the cell-conditioned medium, we actually took that fluid and made it 25% of a face serum, 15% of an eye serum, and 10% of a night cream. Next slide. That is what makes up Klotho Skin. Now, all the studies going forward are involving Klotho Skin, the whole product. So we've done 2 clinical studies, the first one with 10 patients, the second one with 20 patients. 4 of those 20 were a control, and we did biopsies in the second study. For those of you that want to know, yes, it was IRB approved. We had an investigational review board approve it. So what did we find? This is one of the patients from the second study done by Pearl Grimes in Beverly Hills. She's got a very well-known reputation and a big practice. This is an example of one of the patients that actually had a reduction in erythema. What we found out in her study was that there was a 2.5 times global improvement in the patients, but statistically significant results with dyschromia, which means brown spots in your skin, photo damage, rhytids, which means wrinkles, and redness, which means erythema. And we did not expect the latter. So that is showing that the Klotho protein is working on a cellular level, reducing inflammation and oxidative stress. Next slide. This is one of the patients in my initial study. The numbers at the bottom you see can be confusing, 41% and 89%. What you are seeing is 1 out of 100 people. So when the first patient, first slide to the left, came in, she was 41 out of 100, which means she was in the lower third. Check my math on that, Ed. The second one shows she was 89 out of 100. So that was a huge increase out of 100 of patients, just her age. Next slide. The next slide is showing the change in texture. I forgot to say in the first slide, we had a 30% reduction in photo damage. And these are 3-month studies where patients are just using the topical serum morning and night. Nothing else is changing in their daily regime. So on this slide, you see in the beginning, the patient was 13 out of 100. She had not great texture to her skin. But at the end, she went up to 58 out of 100 in the top half. And that's hugely significant. Again, a 30% improvement. Next slide. The final slide, and these are all done with the Vizia scan, which uses a white light. So this is a completely objective study. Photo damage, she was to the left, 34 out of 100, and to the right, after 3 months of using Klotho Skin, morning and night, she was 88 out of 100.
Now, was she using any other products, any other sunblock or anything?
Everyone did use sunblock, but they used sunblock before. So we asked them not to really change their schedule, what they used.
So you really did control for all the variables here that could confound things.
Yes.
Perfect. All right.
Again, this is a patient before and after, and you see her chin resting on the bottom, and the Vizia scan uses a white light.
Get this to go away.
Or this is the Canfield photography. Sorry, Vizia is the other one. This is Canfield.
Okay. All right. You know, that's really a remarkable improvement. You know, looking at this on the big screen, when both the texture and the decrease in erythema, you know, even the deeper rhytids across the forehead and in the glabella have softened. That's pretty darn amazing, especially in just a month.
No, 3 months. 3 months. It was a 3-month study. So this is the very end.
So do you want to tell us
Yeah.
about this
Okay.
slide?
So this slide is showing histology. Histology is when you study the cells under a microscope. And yes, the patients in the second study actually agreed to a skin biopsy before, which would be a control, and after the 3 months on the Klotho serum. In this first slide, you can see the staining of the melanocytes. This would be the cells that give you a change in color, sun damage, photo damage, as we all know, brown spots. And you can see the significant reduction in the layer of the melanocytes, which is going to end up showing clearer and brighter skin. Next slide. Now, this next slide is showing collagen. So the darker pink is the collagen fibers. And remember, we said UVB radiation actually really damaged your collagen and elastin. And that when we did the fibroblast faith in the Klotho serum, they actually had an increase in collagen 4, which is very important for your basal membrane. So this is a slide, as expected, showing increased collagen fibers. Next slide. Ed, take it from here.
So, you know, what we've found in our practice after carrying this product for, golly, almost a year now, it seems like. It's been quite a while. I've been using it on my face, and this face is pushing 70 years young, and it's looking as well as it's ever looked before. But, you know, we talk to patients, and we have our own skin lines as well, but we add the Klotho in because it's a premium product. And we talk about a cell conditioned medium with second generation growth factors, and of course the Klotho protein included. It protects against oxidative stress at a cellular level. So it reduces photo damage, it heals DNA damage, and we talk about it being regenerative, protective, and preventive. And it's cosmetically elegant when you put it on your skin. It doesn't have any strong smells. It feels good as it layers on, and it's packaged very attractively. So great for gifting. You know, the things that we particularly go after, and we take digital pictures of all our patients before, during, and along the way, are, you know, the visible signs of photoaging. We're looking to reduce, you know, evidence of texture, of pigmentation, and of wrinkles. So it fits in with all of the toxins and fillers and laser and radio frequency and ultrasound treatments that we offer for skin and subdermal tissue. I want to play this little video. This is kind of fun. Let's see if we can get this to play, because it kind of encapsulates everything we've talked about.
Introducing an innovative new skincare line that can help you realize that exact possibility. In 1997, the Klotho gene was identified as the first documented age-suppressing gene in mammals that can delay aging when overexpressed. And now, Klotho Skin has patented a process that genetically modifies human stem cells to overproduce the Klotho gene and collect the Klotho protein. Combined with second-generation growth factors, this cell-conditioned medium is the main ingredient in our revolutionary patented face and eye serum. Through further testing, we found that exposing cells to the Klotho protein upregulated 2 other genes that prolong cellular life. Not only is Klotho the first and only skincare line which works with genetically enhanced cells, but studies show that greater than 95% of users noticed improvements in their wrinkles, texture, and UV spots, demonstrating that the Klotho protein may be regenerative, protective, and preventative. Klotho is the future of skincare, an all-in-one treatment offered in medical offices and spas to address skin photoaging. For more information on how your skin does not have to age like everyone else's, visit us online at klothoskin.com.
Kind of cool.
What if your skin?
Let's see if we can. So here is the contact information. Once again, you can use the QR code over on the right or www.klothoskin.com. And of course, 415-400-5444. Sorry, 5447. 415-400-5447 will get you right to Dr. Humble's Klotho Skin. Is where you can pick this up and learn more about it. And I want to thank everybody for listening to our presentation today. Obviously, there'll be questions. And if you get in touch with Dr. Humble, she'll be able to answer those questions because after 2 decades of research, she is absolutely the authority on this. Dr. Humble, other things that we should add? What did we leave out today?
I think just we have to drive home the thinking process that so many of us in Western medicine often wait until there's a disease before we treat it. Well, we do the same thing in aesthetic medicine. We wait until we have wrinkles and photo damage, and then we get laser treatments and neurotoxins and fillers. But what if we could actually change the way we age? What if we can slow the process? I think that's where the Klotho gene and protein really comes in. And I would say all ages could use this serum.
And you've been working on a number of new products that you'll be bringing to market for even us guys.
Yes, we are
We
planning
do
to
appreciate that.
You so deserve it. We are planning to launch one final SKU. We only have 3, the eye, the face, and the night, but we are going to launch a men's serum, hopefully this year. And that's it. Because the beauty of this product too is you use it directly on your skin after you cleanse and tone. And then you can continue with what other products you are using. You don't need to get rid of them. You don't need to change your daily regime. This is just in addition. So save your skin, prevent DNA damage.
Yep. And for this last slide, for those of you who are on the podcast, just listening, it's a picture of the entire Simpson family as a sand sculpture. And Marge has brought along enough giant economy-sized Klotho for the entire family and is putting it out there. Get Klotho, save your skin. So that's what we wish for all of you, is a younger and rejuvenated skin envelope. And thank you so much for joining us. Ask questions and go see Dr. Humble and get some Klotho.
Thank you, everyone.
All right. Bye now.